Hi, I'm Dr. Laura Dominici, breast cancer surgeon at Brigham and Women's Faulkner Breast Center. My job is to take away my patients' fear, help them develop a treatment plan, and empower them to be part of that treatment plan. With each and every one of my patients, I explain the options for surgery, trying to ensure the best oncologic and cosmetic outcome, and help coordinate any additional care they may need. Treating breast cancer can be a very scary process, and I know my patients have questions along the way. I make sure they also have the answers. My husband and I are both New Englanders. After I completed my training at MD Anderson Cancer Center in Houston, I knew I wanted to raise my 2 young children here. Brigham and Women's Faulkner Breast Center is the perfect home for me. Here, I am part of a patient-centered, multidisciplinary team approach to treating breast cancer. The unique design of the program allows me to take care of one patient at a time in a very personal way. And you, as the patient, can rest assured everyone here is working together on your individual case.
I'm Dr. FAINA NAKHLIS, a breast surgeon at Brigham and Women's Faulkner Breast Center. When patients learn about their breast cancer diagnosis, they often experience fear, anxiety, anger, and sadness. These feelings are very understandable, but I'm able to tell them, I'm here to help you get through this. Your condition is treatable and often curable. During the process of getting to know a patient and the unique set of circumstances surrounding this difficult time in her life, it feels as though I lived through this process with the patient. This is what makes this field so unique and rewarding. The biology of breast cancer has always been fascinating to me, from the early days of my surgical training at Northwestern University through today. I continue to learn from the very active field of breast cancer research. There are always new innovations in clinical practice, making treatments safer and more effective and making our patients' outcomes better. I'm truly honored to be a part of this process. I find that the most inspiring and rewarding part of my job, personally and professionally, is learning from my patients' courage, strength, and determination to overcome their cancer diagnosis and work towards regaining their active lifestyle.
Hi, I'm Dr. BARBIE, a breast cancer surgeon at Brigham and Women's Faulkner Breast Center. My primary interest is breast cancer surgery, but I'm also interested in developing targeted therapies for breast cancer and translating that at the bedside. Beginning as an undergraduate at Harvard University and throughout medical school at the University of Vermont, I have always been interested in women's health and basic science. I also really enjoy working with my hands. Creating art through sculpture and painting has brought me great joy, so surgery just seemed like a natural choice for me. At Brigham Women's Faulkner Breast Center, I use my knowledge in basic science and expertise in surgery to explore my patients' treatment options from every angle. When you walk through our door, you really walk into a very special place. I tell all my patients we take a unique multidisciplinary approach to breast cancer. As your surgical oncologist, I'll work with the medical oncologist and the radiation oncologist to tailor your treatment to your specific needs. Studies have shown this can change the outcome significantly. Simply put, patients do much better when everyone works together.
I'm Dr. Peggy Duggan, Chief Medical Officer at Brigham and Women's Faulkner Hospital and Medical Director at Brigham and Women's Faulkner Breast Center. I'm also a breast cancer surgeon. You have breast cancer. Those are 4 very scary words, but you also have power. The power to make choices and the power to be an active participant in your treatment plan. At Brigham and Women's Faulkner Breast Center, you'll be paired with one of our world-class surgeons who'll take the time to understand your unique case and your unique personal needs. We want to know what's going on with you, and we'll give you the information you need to make informed decisions about your care and guide you toward a treatment plan that works for you and your family. Our patient-centered approach to breast cancer care makes us one of the leading centers in breast care in New England and in the country. In fact, since 1971, Brigham and Women's Faulkner Breast Center has cared for well over 100,000 patients. However, what makes us unique is not the number of participants we've seen, it's the exceptional care each and every one of them has received. We encourage women to be active participants in their own health care. When you're diagnosed with breast cancer, you face questions and decisions that can be overwhelming. That's why our specialists take the time to talk with you about your breast cancer, explain your treatment options, and help you to cope with the feelings that can accompany a diagnosis. In addition to your surgeons, all patients at Brigham and Women's Faulkner Breast Center meet with a nurse practitioner who will educate you on what to expect before, during, and after surgery. We provide access to an occupational therapist from the Rehabilitation Services Department who will help you regain your strength and mobility after your breast cancer surgery, as well as a nutritionist who can help you make healthy food choices before and after your breast cancer surgery to optimize recovery. Finally, and perhaps most importantly, we have a social worker who on staff will coach you through the emotional toll breast cancer and its subsequent treatment can take. We know you're frightened. We know you have questions. And we know navigating the healthcare system can be stressful. At Brigham and Women's Faulkner Breast Center, we're here to help you cope with your fear, answer your questions, and coordinate your care so that you can focus on healing.
I'm Samantha Morrison-Ma, nurse practitioner at Brigham and Women's Faulkner Breast Center. I do breast exams, and I also educate patients about breast cancer. It's my job to meet with patients before and after surgery. When we sit down together, we'll talk about what you should expect from your procedure and about breast cancer in general. I want you to understand every aspect of your surgery so that you always know what to expect. I'm also here to answer any questions you might have. Today we'll talk about some of the most common concerns my patients come to me with.
What should I bring to the hospital on the day of my surgery?
Before surgery, you'll receive a checklist detailing everything you'll need to do to prepare for your procedure, including what to pack. If you are staying overnight in the hospital, don't forget the things you need on a day-to-day basis, like your eyeglasses or your hearing aid. For patients undergoing mastectomy, we will provide a special piece of clothing in advance that you will wear home from the hospital. It's important that you bring that with you. And remember, not everyone having breast surgery will get admitted to the hospital. Your surgeon will let you know if you need an overnight stay.
How can I learn about my procedure?
I know you have questions about your particular procedure and what it entails. You should speak directly with your surgeon or with me for the details. We're here to make sure you know what to expect along the way. You will have plenty of opportunity to ask questions at your appointments prior to your surgery. I also tell my patients to keep a list of questions that you think of between appointments so you don't forget when you see us. Once you've met with your surgeon and you know what procedure you're having, we'll direct you to an appropriate information sheet on our website to read more about it, or you can call us anytime. I know it's tempting, but try not to spend too much time on the internet. The most reliable and objective information you can find is that which we will provide to you. If there's something you want to know, just ask. We're here for you.
What is recovery from surgery like?
Your recovery time will depend on the procedure you're having. For the most part, patients who have lumpectomies and mastectomies are up and about right after surgery. The exception is some of the more involved reconstructive procedures. We'll provide you with an information sheet with instructions for the post-operative period, which is generally 2 to 4 weeks. It's available on our website, where you'll find all sorts of valuable information. Do keep in mind that post-operative drains are placed with certain surgeries. Your surgeon will tell you if you will require 1 or more drains. For those patients having mastectomy with breast reconstruction, your plastic surgeon will give you specific activity restrictions during the post-operative period. You'll find an information sheet titled Activity After Breast Reconstruction on our website if you want to learn more.
What do I do if I have concerns after surgery?
There is always a clinician available to discuss your post-surgery concerns with you. You will receive my contact information for other providers like our social worker and your plastic surgeon, among others, and a number for urgent matters after surgery that come up at night or during the weekend.
After surgery is over, what kind of follow-up will I have?
1 to 2 weeks after surgery, you will be contacted by phone with your pathology report. At that point, if you need referrals for more treatment like radiation oncology or medical oncology, we will take care of planning the next steps. You will also have a post-operative visit with your surgeon, usually within 3 weeks. And remember, your surgeon will always be your surgeon, meaning if you have a new lump or abnormal mammogram in the future, you can always come back to see us.
I'm Angela SERIG, occupational therapist at Brigham and Women's Faulkner Hospital. Myself and the physical therapist here treat patients who have trouble regaining flexibility or strength after breast surgery. Today we'll talk about safe, early range of motion exercises you can do at home after surgery, as well as other common concerns patients have about physical rehabilitation.
What can I do when I return home after surgery?
Pace yourself. Take pain medications for comfort during your range of motion exercises, light daily activities, and for sleeping. Immediately after surgery, it's good to use your affected arm normally for light activities like brushing your teeth, washing your face, drinking from a cup, or preparing a light meal. Do try to avoid lifting anything heavier than 8 pounds, which is about the weight of a gallon of milk, for a month if you've had a mastectomy or tissue expander reconstruction, and for about 6 weeks if you've had a tram flap or lat flap breast reconstruction.
Are there exercises I can do at home after surgery?
In the handouts you will receive from the breast center, safe range of motion exercises are outlined. Pictures of these exercises are also available online. If you stay overnight at the hospital, a physical therapist will usually review the exercises with you before discharge. Beginning 1 to 2 days after surgery, try to perform each exercise 5 to 10 times, 2 or 3 times a day. The first exercise is the shoulder roll. Raise your shoulders up towards your ears, then roll them back and down. Try to squeeze your shoulder blades together gently as you bring your shoulders down. The next exercise is the shoulder walk-up. Stand in front of a wall and slowly climb up with your fingertips until you feel a stretch in the shoulder. Hold for 3 seconds, then lower your arm and repeat. You can also turn to the side and perform the same exercise for a slightly different stretch. If you had breast reconstruction and you have drains in place, walk your fingertips up only until your hand is shoulder height, until the drains are removed. The next exercise is shoulder external rotation. Begin with your elbows bent, squeeze your shoulder blades together, and rotate your arms away from your body as far as you can. If you've had breast reconstruction, check with your surgeon before attempting the next 3 exercises. To do the arm saw exercise, start with both elbows bent, pull your arms back further, squeezing your shoulder blades at the same time. Hold for a few seconds. In the back scratch, reach behind you with the affected arm. Try to bring your hand to the middle of your lower back, then slide it up towards your shoulder blades. The final exercise is the butterfly. Place your hands with interlaced fingers behind your head, elbows facing forward. Then gently bring your elbows out to the side as far as you can.
When can I return to my normal activities?
It all depends on the type of surgery you had and your activities. Once your pain is under control, try returning to your normal activities. Just be sure you avoid any forceful activity or lifting more than 8 pounds for 4 to 6 weeks after your surgery. If you're in doubt, talk to your surgeon. Immediately after surgery, you should walk. Walking or any exercise that elevates the heart rate and strengthens muscles will help reduce fatigue, nausea, and joint pain often associated with cancer treatments. It also increases your energy level, elevates your mood, and reduces your risk of developing lymphedema. Plus, studies have shown moderate exercise, such as walking for 30 minutes, 3 times per week, can prevent second cancers among survivors.
What is lymphedema and how can I prevent it?
Lymphedema is the accumulation of fluid that causes swelling in the hand and/or the arm. We know that a small percentage of patients who have an axillary lymph node dissection are at risk of developing lymphedema. The good news is there are ways to reduce your risk. Details about risk reduction strategies can be found in the handouts you will receive. If you notice swelling in your arms or hands, contact your physician. Physical and occupational therapists specifically trained to treat lymphedema can help you manage the symptoms.
Should I have physical therapy after surgery?
If you have trouble regaining range of motion or strength, or returning to activities you enjoy, you might need to schedule a few sessions with a physical or occupational therapist. Talk to your physician for a referral.
Hi, I'm Nancy Oliveira, a registered dietitian at Brigham and Women's Faulkner Hospital. We all know that the foods we eat play an important role in our health. If you are undergoing breast cancer surgery, the right diet can make a difference in your recovery. Today we'll talk about some of the most common nutrition-related questions with breast cancer surgery.
Do I need to eat a special diet before surgery?
Not necessarily. If you're already eating a balanced diet that includes whole grains, plenty of fruits and vegetables, and lean proteins like chicken, fish, beans, egg whites, or low-fat dairy. Nuts and seeds also provide protein, minerals, and anti-inflammatory healthful fats. For an easy guide with many great tips to healthy eating every day, check out the MyPlate website at choosemyplate.gov. Note that about 2 to 3 weeks before your surgery, you will be told to stop taking all supplements, including vitamins. So you'll want to focus on getting all of these nutrients through food as much as possible. The day before your surgery, follow the specific dietary guidelines provided by your surgeon. If your surgeon does not provide you with specific guidelines, then just stick with eating nutritious, low-fat meals.
Are there certain foods that can help with healing after surgery?
Absolutely. Protein helps with the repair and the growth of all of the body's cells. Plant foods such as fruits, vegetables, whole grains, beans, and nuts and seeds contain something called phytonutrients or plant nutrients, as well as a wide variety of vitamins and minerals, such as vitamin C and zinc, that can help to boost the activity of immune cells and to help to repair any damaged cells. These foods also contain important carbohydrates that can give you a steady supply of energy to combat fatigue, which is a common symptom after surgery. You may not feel very hungry a week or two after surgery, so be sure to keep on hand nutritious, easy to prepare snacks like cheese, fresh fruit, Greek yogurt, or nut butters spread on crackers or toast, maybe a homemade trail mix made with unsalted nuts and dried fruit, or even a simple protein shake blended up with some Greek yogurt, 100% fruit juice, and a banana or your favorite fruit.
What role do vitamins and herbal supplements play in recovery?
Vitamin supplements are beneficial if you aren't regularly eating enough foods like fruits, vegetables, and whole grains. And we know that a deficiency of any particular nutrient may delay the healing process after surgery. However, I always try to push food first over supplements because in most cases your body knows how to use whole foods more efficiently than very high dose supplements and herbals. And there are still many undiscovered beneficial plant chemicals, we call these phytochemicals, that may boost your immunity and fight chronic diseases like cancer. You can only find these phytochemicals in whole foods, not supplements. That said, there are certain vitamins like vitamin D for which you may need a supplement because vitamin D is just not found in that many foods. And sun exposure is variable during the year. We can actually make vitamin D through our skin, but we may not get enough sun, especially in the New England area. And research has shown that there is a link with having adequate blood levels of vitamin D and cancer prevention. Another scenario might be if you're a vegan and you don't eat any animal foods. In that case, you may be at risk for certain vitamin deficiencies. In these cases, you should consider visiting a registered dietitian who can help to ensure that you are filling in any gaps of missing nutrients by identifying specific foods to eat every day or to choose an appropriate supplement.
Should I steer clear of soy?
Not necessarily. Soy is a very high-quality vegetable protein, but it contains something called plant estrogens, or isoflavones, which can produce a weak estrogen-like effect in the body. When we look at large populations of women who have estrogen receptor positive breast cancer and eat whole soy foods such as tofu, tempeh, and edamame, these foods actually appear protective against breast cancer or recurrence. This is not true when looking at soy protein isolates, such as those found in soy protein powders and bars, as well as soy supplements that are sometimes promoted for use during menopause. However, you can feel perfectly safe eating 3 to 4 servings of whole natural soy foods a week, which are very nutritious. Note that certain foods with soy in the name, such as soy sauce, soy lecithin, or soybean oil, undergo processing that removes the isoflavones, so those are safe to eat as well.
Is there such a thing as a cancer-fighting diet?
Yes, a healthy diet energizes your body with the basic nutrients it needs daily to build and repair cells and to fight off disease. Lean proteins, fruits and vegetables, I would aim for 8 or more servings a day. Healthful fats like monounsaturated and omega-3 fats, as well as healthy carbohydrates like the ones you get from high-fiber whole grains, beans, low-fat dairy, and fruits and vegetables are an essential part of the cancer-fighting diet. In fact, they're an essential part of a healthy lifestyle before, during, and after cancer treatment.
I'm EILEEN JOYCE, an oncology social worker at Brigham and Women's Faulkner Breast Center. Here, in addition to world-class physicians, state-of-the-art technology, and experts in various fields who help guide you through your physical recovery, you'll also find resources to help you cope with one of the most difficult aspects of cancer diagnosis, the emotional part.
What does a social worker do in a doctor's office?
No one is ever prepared for a cancer diagnosis. Cancer throws life into turmoil when it hits. For some, it's how can I manage work, daily life, and my basic needs. For others, it's how do I cope with the fear, sadness, and anger. As an oncology social worker, I'm a trained mental health professional who specializes in helping patients and families through their cancer experience. Whether it's offering a safe place to explore your concerns and figure out new ways to manage the emotional impacts of cancer, or providing information and guidance with concrete practical advice, I can help you move through and cope with your cancer diagnosis and treatment.
I am so stressed out, anxious, tearful. Is there anything available to help me get through the next steps of my care?
There's a huge amount of anxiety, sadness, and stress that hits you when you hear the word cancer. Waiting for test results, treatment plans, and surgery dates just adds to that anxiety. Many of the people who come to us feel like they're holding their breath for weeks or months on end, wondering what will happen next or what the next test will show. Sometimes having someone to talk to outside of friends and family who are dealing with their own sadness and fear can help you cope with what you're going through, help you problem solve how you will get through the waiting and the fear, and explore and rally your own internal strengths and resources as you move forward. I'm here to help you access new ideas and skills to support you through your cancer care.
Lumpectomy, mastectomy, reconstruction. How do I know what's right for me, and how do I decide what to do?
Obviously, this discussion starts with your physician, who will help you explore the treatment options available to you. Sometimes the decisions and choices are very clear. Other times you're left with choices to make. Healthcare today is much more of a partnership between providers and patients. This can be very empowering. You're given information and, where possible, the opportunity to decide the path that's right for you. But it can also be very scary when you're faced with several options, each having their good and bad. You may be left wondering which is right. The reality is, when your doctor gives you information and choices, there may not be an absolute right or wrong. Rather, you may have to decide what's right for me and what's wrong for me. I can help you sort through your thoughts and feelings, figure out your questions and concerns, and come to understand what is right for you and why.
How do I tell my kids about my cancer?
As parents, we want to protect our children. Some of my patients ask, do I need to tell my kids about my cancer? Others ask, how do I tell my kids about my cancer? I'll help you think through what is best for your kids. Together, we'll consider how to tell them and explore the specific language you might use to help them understand what's going on. I can also help you access other supports and resources for your children as you move through your cancer treatment.
How do I move forward after a cancer diagnosis?
There are more cancer survivors these days than ever before. As we improve our ability to diagnose, treat, manage, and cure cancer,
So many people are now exploring the question, what now? As your oncology social worker, I can help you explore this question, learn new ways to cope with the impact cancer has had in your life, and connect with survivorship resources as needed. Remember, you may have cancer, but your cancer doesn't need to define you. I'm here to help you explore what your cancer experience means to you and how it fits into the whole person that you are as you move forward.